they said that we want to make a product as cheap as a thermometer, whereby every household in the world can have capacity to buy it and do his self eye exam. That is the vision. So the product is going to be as cheap as a thermometer. So you can just imagine, and they are going to produce it in a very huge, large scale. And now we can see that this product once comes into the market. Let's see what happens. So in the future will that. Then I'm showing about this some other instruments like Peak and this company called Smart Vision Labs and iGo. They make very inexpensive product for eye imaging. I'm sure you are facing the challenge, but I'm not. If you may not be facing it, but in the private sector, we face challenge from the short-term courses by eye mitra and vision technicians because of the hit the opticians have taken. They are looking for a cheaper human resource to employ, whereby they can pay less and get the job done. And this is a threat which is emerging, whereby they prescribe glasses and contact lenses, which is illegal, but they are doing it, and it's a threat to optometry. Well, what is the way forward? What optometry need to do? When you have an eye exam, which is available free, when you have devices like this, the only way for optometry to move forward is education, education, and education, whereby you are advancing your knowledge, your skills, and looking at beyond refraction, educating your patients coming to you that an online eye exam or self-assessment of eye exam is not a comprehensive eye exam, whereby many eye and other health conditions may be missed by you. So educating your patients about the importance of eye exam, as well as advancing your knowledge to the following categories which I am going to talk about, is very important, and that's the way forward for optometry in future to come. One thing I want to tell you is this, that optometry need not shift its base from primary eye care optometry. They have to stay focused on that. Only thing is this, that they have to increase or enhance their knowledge of lenses and technology products. They have to know about what are the latest products available in the market, and that explanation you can't leave it to the person outside in your optical outlet, optometry outlet. That explanation needs to go in the clinic, whereby all the explanations are done inside, and all the products, contact lenses, you must know the latest, what is available. In spite that whether you practice this, even if you are in an institution, you must have, because we have a phobia that I'm not working optical outlet, so I should not know about what are the products available. So that one has to come out of that and should have the latest knowledge about lenses and latest technology about in the optical industry. But this is something which I want to talk to you slightly. I'll spend some more time on this. Diabetes and glaucoma. I'm sure Dr. Singhala spoke to about the prevalence, and then India is a diabetic capital of the world. We have 800 million people who are above 40 years of age, and out of that, 8% of them, I'm not aware, but about 75 million or so are diabetic. Out of that, 1/6 of those patients will have diabetic retinopathy. And out of those 1/6, again, 1/6 of those who have diabetic retinopathy will lose their sight because of diabetes. So you can see the impact, and you can see how threatening the problem is. So optometry has to take first step in knowing more about diabetes, knowing about the how. I was listening to Jyoti, she said about what nutrition the patient needs to take, what kind of lifestyle patient needs to take. Because optometry is not just giving glasses. We are known for a profession which talks about health education, health promotion. You need to tell patient just by simple reducing your weight by 10% reduces chances of diabetes by 50%. just reducing your weight can help you manage your diabetes. Just quitting your smoking. People who smoke, just telling them to quit smoking, again reduces the chances of diabetes by 50%. Telling them to just go for a morning brisk walk for 30 minutes, only 30 minutes every day, reduces 30% chances of people developing diabetes. So this all, whether the patient asked or not, your job, somebody was asking me, the patient may ask you what to eat. Even if the person doesn't ask you what to eat, it's your responsibility, your job to educate patient what they should eat, what the kind of lifestyle they need to take, they need to adopt, and what they need to do about managing diabetes, because ultimately it's a chronic disease which lasts a long time and patient has to learn to manage the diabetes more than just treating it. Well, an instrument like, I'm very thankful to Pramod Badani, who is the sales head of Remedios, for organizing or sponsoring this program. But every optometric today must look at or look into investing into a retinal camera. Reason is, once the reflection slips out of your hand, you have nothing to show your face. You need to see